This is a 66-year-old male shoulder. You can see we have, this is the subscapularis tendon. This is a shaver that's in the joint. We're looking from posteriorly. This is the biceps tendon. These fibrillations, the biceps is essentially completely ripped, frayed. You can see the biceps right there. It's totally torn. We're coming over to the side here laterally. This is the rotator cuff. And you can see the rotator cuff is not in good shape. You can see a deeper tear, almost a full thickness tear in that area. The joint, this is the humeral head, relatively preserved. There's also a lot of inflammation in the joint. That little fibrillation that we're looking at is some arthritis on the joint. And the labrum in the front is relatively preserved. We're now looking at the coracoid process. One of the reasons that you get the tear of the subscap, which you can see here, partial tear, and the biceps rupture is a large prominent coracoid. So I've cleared this coracoid, and we're going to shave this down to prevent progression of the tearing of the subscap. We now have the burr in the shoulder. This is a motorized instrument. We're going to shave down. This is water. The medium is water, and we have suction. And this coracoid is quite hard and sclerotic. Which is why it got that subscap in trouble. But you can see now we're shaving it down. It's going quite excellent smoothing of the coracoid. And you don't have to take much. 3-4 millimeters is usually plenty. This is a pretty tight space in the anterior shoulder, so just a little clearance will, we're up on the top of the coracoid. And 3 muscles insert into the coracoid. Coracobrachialis, pectoralis minor, and the short head of the biceps. This is the deep surface. They don't insert on the deep surface, so those insertions will not be disrupted. As you can see that this is the rotator cuff. There's the hole. It's about a 90% tear. In here, not so bad. So we're going to leave this part intact, and we're just going to work on the other part of the tendon. And you can see also a lot of synovitis, all this redness. This is the tear of the tendon. Our shaver now is in the bursa, and we are going to prepare this tear. I'm ronduring down to this is the greater tuberosity. This is the footprint of the rotator cuff, and this is where we're going to repair it right here. So this is a pain generator, and we're preparing our bed. This is at the junction of the infra and supraspinatus right here. So we have now prepared the greater tuberosity footprint. This is an anchor that's screwed into the bone. It's resorbable with 4 sutures in it. We're going to pass those sutures and tie this down. And I'm just kind of looking at the rest of the shoulder here, and there's our subscap. The biceps has been cut. We're going to repair it extra-articular. We are now in the bursa, and you can see this is where we place the anchor, and we're going to grab the suture now. We're going to grab the blue suture, the one closest to the cuff, and we're going to pass it with an instrument. We're grabbing it right here. And now we have tied the suture. There's the stripe. The blue one is in there. We've tied down the rotator cuff tear. We are now looking from the side. You can see our 2 stitches, our striped, our blue. It's up under some of the bursa. Nicely attached. Now we're going to look inside the joint. We are now back in the joint, and you can see where we had that big hole. The rotator cuff is now nicely along the articular margin. So it's an absolute perfect anatomic repair. All this red stuff is a lot of synovitis. That's inflamed tissue. I'm going to try to just get rid of some of this inflamed tissue with the coag. This is just synovitis. It's not functional tissue, but it does generate a lot of pain. So we're just going to get rid of this. This is just like what they call a arthrocare wand. We're just going to get rid of some of this synovitis. And that's it for the articular portion.